In this video, we're going to be talking about how to eliminate styes, or officially known as hordeola, at home to get the red pustule pimple-looking thing off of your eyelids, because these are things you can do at home in order to get rid of them. Be sure to stick around for the last method, which is going to be one of the most effective methods I'll talk about in this video. But let's talk about the first method. So you wake up one day, you got a pimple on your eyelid, or it kind of hurts, or multiple pimples happen around the eyelids. Historically, how this has happened is there is some level of bacterial buildup that has gone down into one of the meibomian glands or other glands around the eyelids, Styes, mole, anything you can think about there. There's a lot of glands around the eyelids. But basically, there is a gland around the eyelids that has harbored too much bacteria, whether you got some type of level of bacteria in your eyes, or just happened to get there, or someone with pink eye actually touched your eye or anything like that, that actually allowed that concentration of bacteria and colonization to increase and create the red irritatedness on the eyelids. One of the first things we do, and again, this is professional mixed with personal opinion as a disclosure, so this is by no means a hard, fast rule to be like, you must do this. These are just things that I talk about with patients of options they can consider. And if you have further questions, be sure to talk to your local eye care professional to dive deeper on what specific treatments might work better for you than these. But the first thing you can do is to use a warm washcloth. So we talked about in previous videos that use a cold washcloth to take care of inflammation and bagginess under the eyes. But in this case, we're going to want to use a very warm, if not a very hot washcloth to kind of put over the eyelids for at least a few minutes, a few times a day for a while, because that heat will kind of open things up and allow more fluid, white blood cells, everything to move in, take care of that little infection that has caused the gland to swell up and puff up and look like a pimple, basically. So a warm washcloth a few times a day is the first thing we like to recommend. The second thing we like to recommend is sometimes you can use baby shampoo to kind of clean the eyelids, or eyelid scrubs. There's a lot of different manufacturers and brands that exist out there for this, but you can use an eyelid scrub or baby shampoo to kind of clean out some of the glands, and gently, like when you're taking a shower, when you're taking a bath, just kind of be very gentle around the eyelids, just gently clean them to clean out all the excess bacteria colonization that has allowed the bacterial form of of the hordeolum, also known as a stye, to build on certain sections of the eyelids. And this is usually can be pretty effective if it hasn't gone deep into the eyelid itself, because there is a tissue called the orbital septum, which think of it like a wall that kind of keeps all the inflammation and infection out. But sometimes when that infection penetrates deeper past the orbital septum, there's usually a third most important critical method to get rid of that hordeolum. And it's very different than a chalazion, because a chalazion is just a large bump on one of the eyelids. It doesn't look like a pimple. It kind of looks like a knot or a knuckle or something like that, where it's just a high level of fluid inflammation or something that's harbored there, which there's some different ways you can get rid of that we'll cover in another video. But for this, we're going to stay on the hordeolums, or hordeola, or styes. So the last thing you can do is when you talk to your local eye care professional about what you can do in order to get rid of this little pimple looking thing, there's two things that we often consider. One of which is, have you tried the previous methods? And if those have failed and not resolved, or if it's gotten so bad and so swollen to where it's getting out of control, we usually like to use a combination of antibiotic eye drops or antibiotic pills. And this can vary per provider for who is more comfortable doing what. Usually, sometimes I do a combination of the two if it's pretty bad, but sometimes I'll start with just the antibiotic eye drop as well. This can come in a variety of forms for what we typically prescribe, but it can also come in a variety of forms for antibiotic pills that we can prescribe as well too, in order to get the inflammation down. Because the way I like to describe it to patients is like this. You've got a nasty little infection that I want a twofold approach to. I want to attack it from the top side with the eye drops, and I want to attack it from the back side with the systemic absorption of the antibiotic pill. And that's up to your provider to discern what is going to be best for your eye's health and care in order to get the stye or hordeolum taken care of. And those are the ways that I usually like to get rid of the hordeolum, but those are the most common methods. There are several other methods that a lot of providers choose to do, as well as myself. Those are just the top three I like to consider. But hordeolum can be very painful. It can feel awful. It can cause goopy, pussy, weepy discharge. It can come on pretty acutely, or it can build for a couple of weeks. It can come from pink eye conjunctivitis. It can come from a variety of pathologies that can lead to the pimple-like appearance on the eyelids to make your eyes not feel good, as well as you maybe not seeing that good, possibly. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications to learn more about your eyes. I'm Dr. Bryce Heffington. We'll see you next time.